we will have a panel discussion which will be chaired by Mr. Partha Dey, and who has been our advisor for a very long time. And not only he can talk about his current role as founder of a AI-led startup, but he has been also part of larger healthcare system, part of leading hospitals and managing the digital transformation. So we are very fortunate to have you, sir, today. And along with Mr. Partha Dey, we have other uh, eminent uh, contributors, Dr. Pushkar, who is representing Public Health Foundation of India, and I'm sure he could share more details later that how digital is going to play a role in public health. We'll have Dr. Amit Raj, who is also quite hands-on involved in using all kind of digital interventions in his hospitals in Gujarat. Pada sir, I would like to welcome you again, as the chair of this session today, that if you could start by sharing your thoughts maybe on digital health, and invite other panelists as they are joining into this discussion, and if we can build this conversation, like I said, which could also inform us to plan for our annual conference later this year. So over to you, sir. Welcome. Thank you very much for joining us today.
So thank you, Sachin, for the opportunity. It's always nice to be back in the club meeting, and I try to always be there, whether I'm speaking or I'm listening. That's the we all enjoy the club meetings. Topic that you guys have decided, it's very important, close to my heart, and not only to my heart. I think whoever is joining in this club meeting today, it is close to everyone's heart, and very important that we start practicing digital health. So I want to start telling this. We have attended multiple conferences. We had multiple meetings in different times over last maybe 6 to 7 years more. So compared to the earlier years, but now the time has come to absolutely start practicing and embracing digital health in all our life. This is not only about the professional life, this is also about our personal life whenever you are using healthcare. And I always draw a parallel with what has happened in the fintech. So if you see today, the way we are using digital currency, how we are using banking services, financial services, uh, completely a change that has happened in everyone's life. For paying even a sabji wala, a vegetable vendor, we are not using cash anymore, and gladly they are accepting the digital currency. UPI has a big impact, probably the biggest impact among any other fintech solutions that have had. And I always think what UPI has done, exactly the same thing this national health digital health mission can do. And in my understanding, this is exactly the replica of how the UPI is working in making sure that the transaction between the banks and the other fintech companies are becoming very uh, quick, accurate, and very easy. That's very important among the consumers. That same experience, National Digital Health Mission has the capability to create similar experience in healthcare. Now, this is a very important time in our life. We have seen in our professional life that healthcare coming directly from all paper based to paperless based, and now it is coming about interoperability where the paperless transactions would happen between organizations. If you look at the history, how we have started digitizing or automating a part of the organization's workflow. I remember when I have started working around 94, 95, then we used to have a department in the hospital called EDP. It was more like electronic data processing. And what I remember, most of the guys, what they used to do over there, they used to type various reports. Could be a pathology reports, radiology reports, or operating notes, surgical note, etc. So the department was limited to create sometime a, you can say, a electronic copy of the manual records. And now from there, today, everything is being automated, starting from registrations of any customers, looking at booking their appointment, uh, collecting payments, making offer on that time of what is the kind of a pricing offer or packaged offer will be suitable for that customer, which happens for any other e-commerce organization, that has started happening for healthcare organizations too. And then even some point of time, telling that customer that, who would be assisting you when they reaches in hospitals, or when someone reaches home, to provide the services to them. This is more like a Zomato equivalent of a healthcare workflow trying to be worked out on a digital platform. Now, while we are doing this, looking at interoperability of the healthcare data between the organization becomes very important. Earlier, we looked at automating or digitizing the data in one department. Then we looked at between departments, so that between the two departments, two HIS departmental flow, or maybe two different HIMS applications can interact with them, among them, using HL7 on all other protocol that was going on earlier. But now the time has come for us to create a UPI equivalent, so that any healthcare data, and any is any, should be accessible depending on the need. One point I always would like to put over here: when we are putting more data digitally, we have to be very careful about three aspects. One, definitely the privacy and the confidentiality part of the data. So it should not happen the data is available in a digital format, and now it can be accessible by anyone. It should be accessible by the person who need it. No one else has got any right to look at the data. Now, some point of time, people do say that once you put the data in a digital manner, so this could be a challenge. This is a challenge, and we must address the challenge. Number two, Sachin, this is more your subject: how we ensure the data security part of it. While we are storing the data, we have to ensure that no one else, any unintended users, are able to get this data out, or have any unauthorized access of the data. So, privacy, confidentiality, and data security, these are very, very important point when we are talking about the digital health mission. Digital health mission, currently renamed as Ayushman Bharat mission, as we all know, has created a national health ID, or Ayushman Bharat ID, whatever the name we give. But I think this is the most important thing has happened by any government initiative to make this digital health enabled between the organization. Without this unique identifier, whatever we were discussing over several years, nothing would have possible. I'm not too sure whether all of us being in the club meeting today, whether we have our own health ID. I don't know, is there any way to ask questions? I would love to understand from the participants if they can raise hands and tell us that whether I would expect everybody, every one of us in the club meeting should have our own digital health ID at least. For us as an individual, and also for the organization, we must represent, we must register our organization, whatever the organization we're representing, with the mission, so that we all are participating in this overall process. We'll discuss more while we are in the club meeting today. I will request Dr. Pushkar, if you can introduce yourself, sir. You are coming from an excellent organization. You are working with both industry and academia. There's an excellent opportunity, and you guys are working on scaling. That's probably the most important thing among us that we need in the resources to enable them to use the digital health platform. So over to you, sir. If you can just give us a quick introductions, and then followed by, if you can just share your initial thoughts about this National Digital Health Mission. I will probably request your permission to ask you a couple of very specific questions, and then we'll open the floor to everyone. So Sachin, if it is all right with you today, we probably can change the pattern of the club meeting. We can make it more interactive in nature. I think that will be good for us, and it will give us a great learning as well. Over to you,
Sure,
Dr.
sir. It's your panel, and you can run it the way you want.
Chalo. Okay.
Thank you, sir. A very good evening to all our viewers, Sachin ji and Mr. Partha Dey as well. And thanks for inviting me first to give the overview. Both I represent Public Health Foundation of India. PHFI is a public health, public-private partnership. And before we get into the National Digital Health Mission, I thought I'll just have a short 15 slides presentation. So I'll be just covering a bit about the leveraging digital technology in the skilling area, capacity building of healthcare professionals, where Public Health Foundation of India does work. I'm a pathologist by background, having started my career in Apollo Hospitals, Delhi, sir, from your esteemed organization, and worked 10 years in the government sector as well. And I head the training division at PHFI. So public health, this PHFI is a public-private partnership set up by Ministry of Health and Family Welfare in 2006, and represents the partnership for public purpose. So we have a esteemed board representing both government and the private sector and the academia as well, headed by President Professor K. Srinath Reddy. And of course, the chairman is Mr. Ramadorai from the TCS Tata Groups. And the Charter of Public Health Foundation of India covers education, training, research, affordable health technology, which we'll be a bit covering now, health system supports, communication, and policy development. And we also have our 5 Indian Institutes of Public Health in Delhi, Gandhinagar, Bhubaneswar, Hyderabad, and Shillong, which are located in these respective states. We have a campus, the auxiliary campus in Bengaluru, working again closely with Government of Karnataka, where public health teaching in Masters in Public Health and other programs, PhDs, and other educational and research activities are undertaken. And PHFI is located in Gurugram, Gurgaon. And coming to the capacity building arena, because the primary care physicians are the first line of contact, the backbone of the referral system. This training division at PHFI started its journey since 2010 to start our training in capacity building for primary care physicians, and gradually went on to other healthcare professionals, nurses, lab technicians, and other healthcare professionals across the country. So we started our journey with a diabetes program. These are certificate courses in evidence-based diabetes. And we started with a journey with 100 centers where a batch of 20 doctors were trained across India specifically to build their knowledge and skills in the field of diabetes, with Dr. Mohan as an academic partner. And over a period of time, with every year, we started building 2 to 3 new programs, from the gestational diabetes, thyroid, mental health, women's health. And no year we have set up a gap. We have healthcare quality. And so we have now 27 capacity building initiatives for healthcare professionals. And in digital arena, coming back specifically to our topic here, with thanks to InnovatorCLUB, both Sachin ji, who is our mentor and faculty, and Dr. V.K. Singh sir, who is our guide here, we started our journey with a cyber course in cybersecurity in healthcare and artificial intelligence in healthcare. 2 programs specifically with InnovatorCLUB. We also have a certificate course in healthcare technology with again an esteemed partner. Dr. Meena has been one of the first speakers when he was a NHA, and he's also part of this LMS course in digital course in healthcare technology for healthcare professionals. So certificate course in healthcare technology, we have partnered with Association of Healthcare Providers India, HPI, Indian Institute of Science, Bengaluru, and Indian Institute of Space Science and Technology, Trivandrum. So esteemed partners with PHFI, we set up basically a 5 modular program. In 2021, we started our journey, and it's on a learning management system. 48 healthcare professionals have already been trained. We cover the topics on healthcare technology, its practical application, inpatient management, in functional management, innovations in healthcare, technology, regulator, and policy and practical aspects. So this course is running quite well across India, though we are progressing quite slowly in this journey with our esteemed partners. We had a course in artificial intelligence in healthcare. We already completed 2 batches. 92 healthcare professionals were trained in this artificial intelligence, and this course has been really very well accepted, covering all aspects of artificial intelligence from diagnostics to patient care. I think Sachinji can always add his own input, since he has been a part of the both our courses in AI as well as in cyber security in healthcare. This is another course we started both during the pandemic. So all the privacy, the confidentiality, Mr. Partha, you just mentioned today, these are key elements in this course for cyber security in healthcare professionals, which PHFI along with InnovatorCLUB has conducted 2 batches again for this course, and all basics in internet and cyber security, because cyber crime is very much important, and in healthcare we have to safeguard both our devices to the data of the patients to the reports, everything. So cyber security is very much important, and we have already trained 65 healthcare professionals, and now we are looking for expansion of this course for adoption by the respective state governments as well. Recently, for WHO India and for the Child Health Division in the ministry, we completed a digital version of IMNCI training package for healthcare professionals. This is for ANMs and community health officers. We conducted in Hindi version, a training 6 hours of videos, and this is on the WHO Swasthya e-Gurukul package. The ministry is just taking its time to give the go-ahead and conduct a pilot. The course is now ready with the WHO and on the website of eSwasthya Gurukul. So, though PHFI has started our courses both in the physical mode, over a period of time in the skill building arena, we have used the digital technology to quite aspects. We have conducted courses in obesity management for primary care physicians with our partners Chelaram Diabetes Institute and World Obesity Federation as well. And again, 100 plus doctors, MBBS doctors have been trained in this LMS course in obesity prevention and management, which has been very much in demand. With Chelaram Diabetes Institute, we are conducting a course on diabetic foot management. So this is another program for MBBS doctors we are conducting pan-India and covering all aspects of diabetic foot prevention and management. A bit about the whole portfolio of the training division at PHFI. We have trained 38,500 plus doctors and healthcare professionals across pan-India, 600 plus faculty, 600 plus centers. Though located in Gurugram, our faculty participants are across the country. We have partnered with 12 state governments, and more than 26 state governments have sent their participants, doctors, nurses. We are skill building partners for Madhya Pradesh and government of Tripura as well. So our various trainings from diabetes to mental health or other programs in the digital technology. Our partners, we have worked both in industry, academia, internationally. We have even expanded our courses to 10 other countries in Southeast Asia and Africa. And though we started, I'll add a few points. These are, of course, our awards and various achievements. We started with a physical training where in a classroom, teacher would teach 15 to 20 doctors in a batch. In the course of the journey in the last few years, trainings are also being conducted on the Zoom, Microsoft, online platform, LMS. From giving a hard copies, now we are also and pen drives and CDs from 2010. Now all the training materials, modules in advance, we are giving on an app. PHFI has its own app. The participants can download all the training material prior to the course and take it home. On a website, they can access those materials. From enrollment to certification, attendance, pre-test, post-test, exit examination. we have used the digital technology for each of the capacity building in arena. Physical has its own merit. We still do that for the state governments as well as others. We have now expanded into the digital technology for each aspects of conducting these trainings. And this has helped us save time, use more technology, new training programs. And though we are running now 27 programs in healthcare sphere, we expand our database every year with 2 or 3 new programs. And as per this demand, like oncology, we are now working on it. Maybe next 3-4 months, we will have another course for that as well. So any aspects where healthcare professionals will require an updation of skills, PHFI and the training division has been working, and this has been possible with working with the different partners and across. So this is in short, I wanted to convey about our program and in the digital sphere. Thank you.
Thank you, Dr. Pushkar. You guys are really doing a great job. We all know that. And the skilling, as I was telling, that is very, very important. If we don't have skilled people, then definitely whatever we discuss in this conferences, club meetings, it has got no meaning. We need to have a skilled people and appropriately trained by the right organizations. Your faculties are really great, particularly these 2 programs that we talked about that you are doing with Sachin on cybersecurity and artificial intelligence. This is a very important course. I hope more people would be taking up this course in future. I can see Dr. Amit Raj has already joined. So good evening, Dr. Amit. How are you, sir?
Very good evening, sir. I'm good. Sorry, I've been a little late.
Yeah. I understand you are a practicing clinician and you are always excused for your clinical work.
Yeah, there's a primary here, so we are gearing up for that.
Well, understand. So, without wasting any further time, I'll request you if you can please share your thoughts about the initial thoughts about this digital health mission. If you have any specific first 5 minutes of thoughts that you want to share with us, what the first 3 things coming in your mind when you were starting the club meeting?
All right. First of all, thank you, Sachin, Dr. Singh, and the entire team for this lovely, program. Well, to just come up to the point on digital national digital health mission. Previous presentation on coaching teaching program on AI is definitely the need of the hour, because we see digital penetration, which is really going to change and bring in a lot of newer modalities of approach to enhance patient engagement, patient education, doctors, assistants in digital program. Well, I mean, there's a way, a huge roadmap, in front of us. Like I'm currently working on, a VR model for patient engagement in cardiology and cardiovascular. I mean, shortly I'll be launching one of, a VR program into my ecosystem. But before this, I had done a small course on AI in cardiovascular sciences from European CME program, which was very much helpful in learning how Europe and US are getting into this digital approach, and India being a huge population of such huge population and lack of doctors. Well, I see a huge opportunity of digital route over here, and with the government policy enhancing and helping entrepreneurs and medtech guys to come in and innovate in their whichever approach, and probably come out and probably get a use case study to the government and probably adopt those in our regular practice. I mean, I see that in the next about couple of years that should be in our new future. So teaching program on AI in cardiology, in medicine, in kind of any pediatrics or any other departments, definitely. I mean, this will help us with kind of a digital approach, because I am seeing the results in my organization with this digital. We are doing a pilot here in our hospital where we are engaging a patient using an VR and an AR headsets, where patient do get informed about their procedure, about what exactly is going to happen to their heart. So on a 3D mapping, we just take out a a patient's heart with a clone of a doctor, teaching the patient what exactly he needs. For example, I am as a clinician, I have a array of 10, 20 OPDs waiting when I'm busy in my procedure, where my clone will come and explain what exactly the doctor wants to educate the patient and engage the patient on. So post COVID, does the trust among the doctors and the patient has really dwindled. So digital is one of the areas where this route is really bridging this gap. So I see a huge potential and huge roadmap of this digital approach as well. To add on, there are many medtech companies, many fin medtech companies who are coming in with various innovations. As clinicians, we need to kind of adopt those in our ecosystem, try to learn more, have a team to kind of educate the doctors, educate the nursing, educate the critical care team to how this digital adoption can bring a lot of change. So I will definitely one of the days, maybe few weeks later, I will get on we are working on a small kind of cohort study where number of patients using a VR tech has really felt nice about the approach and how this has changed them in understanding their own disease and understanding how the doctor can really help them in educating themselves about this program. So this is possible with the digital approach.
Absolutely. Thank you so much, Dr. Raj, and really using this VR and AR to give the patient and sometimes probably the relatives to tell about really what is going to happen during the surgery is a fantastic idea. A lot of time the anxiety is more about not knowing what is happening, and sometimes using too much of a Google information becomes a problematic thing. Because unfortunately the Google ranking does not depend on the authenticity of the information. Google ranking depending on one, who is paying Google more money, and two, who are the people seeing what information more in Google. And unfortunately, the negative, sorry to use the word here, gets more clicks compared to the real authenticated information in Google. And there is nothing problem with Google if they can provide the right information. As a healthcare professionals, we all are happy. I'm sure as a clinician, you'll be happier if your patients are coming better prepared. But unfortunately, what is happening? They're coming with a half knowledge, and then that is getting the problem. It becomes, earlier we were thinking when people will have the information, it is easier probably for them to make the decision. Now, when a lot of interactions, and I'm sure you are also finding the challenges that convincing will become very difficult because they are coming up with all half information and they have seen about some complications somewhere, and they don't understand that how often it may happen or it does not happen, and then it takes a much longer time for you to explain the whole thing. But with this, when they see kind of a real life experience of how things is being done, I think it will be much easier for them, very comforting for the family as well. And as you are creating it, I'm sure this is absolutely authenticated information. It is not like a half-baked things that they are using from the internet. So fantastic idea, Dr.
Yeah, and one more key important is on patient data security, hospital data security, which is now with insurance penetration going at all levels. So the next challenge is going to be on how a patient data is secure and how not much of fudging can happen in the patient's data on the insurances. Because this is now for the last 3 months I've been facing the challenge both from the government and as well as from the private insurance companies, that how how hospitals should help in safeguarding the patient's data and especially their own data. So because my knowledge is little feeble, but I'm sure with a team like with a mission like this company, I mean you guys are doing. I mean data security should be also on the on the limelight, that tomorrow patient's own data is it will definitely help him not only monetize but I mean for his longer tenure, because now most of the insurance companies I'm seeing patients are getting denied approvals for any other reasons. I mean for vague reasons, just because patients have been lacking their own data and which is not secure. And so we see a huge challenge tomorrow. I'm sure this digital approach on data security, on patient engagement, adding on benefits to helping as a digital physician assistants, especially in diagnostic and as well as therapeutic. This modality of digital is changing, and in the next 10 decades, I would hardly see larger hospitals which is going to be a digital hospital, which will be in cloud, and super specialty centers will be flourishing.
Correct. And I think with various things are being articulated appropriately by National Digital Health Mission, once we follow them, like they are trying to create a tunnel where nobody else will have access. Today, what is happening when we are sharing data with insurance companies and a lot of other organizations, most of the cases it is going, unfortunately, mostly on WhatsApp. We don't like it, but at the end, this is the reality of life. And I think everybody has accepted it. Number two, it goes over email, or there are times where the data exchange that happens, right? So all these platforms are kind of more open platforms. So there are times when the person who are not supposed to get this, they get access to this data. With this, the technology platform is being built by National Digital Health Mission. When the data exchange happens following a particular pattern or a particular norms, then this will be much more secure. I think only the intended participants will be able to access the data, and this will be secure. And from a patient perspective, also, what is going to happen is that at the day end, the patient is the owner of the data. All of us are the custodian of the data. The patient would then decide by sharing the OTP that how and when they want their data to be accessed by others. I think this will be a very good empowering things in the patient's hand. They will then decide that which recipient for what duration can access their data, which is not the case most of the time today. If we all will follow how National Digital Health Mission is going to establish as a nodal agency for the data exchange, I think after 1 year we are having the conferences on the same topic. We will discuss a complete different way, because by then I expect a lot of us would have experience of sharing the data using this channel, which probably we don't have today. And personally, if you ask me, as my startup organization, we are facing challenge. We have applied around probably 6 months or more than 6 months back to become one of the partnering organizations. Our application is still on hold, and whenever I try to reach out to some people over there, they keep telling us that we have too much of work in hand. Now, this is not an excuse that any national body like this will be using. And unfortunately, there is a way that we can put up a ticket. So whenever we put up a ticket, the ticket gets closed within 1 or 2 days, telling that there are too much of work, and it will be taken up when we are free. Now, this is something is a completely unacceptable status. I am sure there are people working on. I have reached out to other people in other means also. I hope this is being taken care of, and all of us, when we are applying, we should be able to get ourselves registered maximum 7 days time. If that does not happen, then definitely if the number of players are not more on this platform, then this platform would have no future. Right?
Absolutely.
Two things need to happen. One is that this needs to get popular among individuals, the patients. They should all have their national health ID or Ayushman Bharat ID, whatever we are calling now. And all of us as an organization should have our own organization ID registered, and in a manner that we can exchange data. And I started telling that, this should be a UPI equivalent, the way the banks are able to transact, and there are lot many other fintech companies are transacting data. So I think we need to create and use that UPI equivalent platform, that is National Digital Health Mission, for all of us, right? So, Dr. Amit, thank you very much for sharing your thoughts. I saw there are a couple of questions were coming up. Just I would like to see what is the question. Is there anything that any one of us can take up? Otherwise, I will go to Dr. Pushkar with the next sets of discussions. So one of the question is coming from Rajiv Kumar, is about the government offering any incentives for onboarding private sector. I'm not aware of any such direct incentives. What has happened in US, hopefully some point of time it will happen. But if you ask me, as a private sector organization, the most incentive is about the patient satisfaction. Today, patients are carrying a loads of data. And as a clinician, some point of time, Dr. Amit and others are facing huge challenges and not able to treat the patient appropriately because they don't know what has happened elsewhere. So for a private organization, once they are in a position to exchange data, get to know more about the patient, and the clinical outcome becomes better, I think there is no incentives can match this. But some point of time, I would expect or rather urge government organizations to come up to enable smaller size healthcare organization to participate in the program by providing some incentives. Could be, and incentives may not be always a cash incentive. Incentive could be like the way a lot of times accreditation program has worked. You get 10% more if you are NABH accredited in some government programs, right? So similar kind of incentives can be worked out to popularize these programs. If we are not able to take the smaller size organizations into this flow, then we will miss probably 50-60% of the healthcare ecosystem in India. Healthcare ecosystem in India is not run by the bigger size corporate hospitals. They hardly cover not even 10%. So if we have to cover, or not if, we need to cover the rest of them, and they would need some amount of help and assistance from the government to do that.
So I'll just add on, few companies in US, what startups, what they've done is they are paying the patient to digitalize their data. So patients are getting paid. Monetized. Their entire health record, they are putting it in a digital format in whichever way of safety, and they're getting paid by private young startups. Coming and then that maybe can be one of the incentives where young startups can come. I've seen this working very smoothly in US because they want to sector wise, city wise, small area wise. They've been having these campaigns to go paperless, go online, go more of digital. Where we save and their data is safe. So maybe in near future, I'm sure many startups will come out with some innovative ways to save their data. I'm sure. In next about a decade or so, this would be in fashion.
Correct. So this could be one of the things, but I'm sure there will be a lot of other things will come up or is coming up rather, so that this interoperability of the data become absolutely possible. So, Dr. Pushkar, I would like to come up with a very, very specific question, and I think Sachin will be happy to get the answer. This is more about, we are seeing many initiatives are happening. If you look at in the Scandinavian countries, probably they are ahead of other countries. I know a couple of my friends who are working over there. They are coming up with a lot of digital initiatives. Sometimes we keep talking about it because as a country they are very small. It's very easy to implement things over there. They're not like a complex systems like in India that we have. And health being a state subject, it becomes more complicated. There are a lot of political annotations comes even if there is a will. So how do you think, what do you think is the barrier, or rather I would suggest that what do you think that we need to remove as a barrier for implementation of the digital programs? There are several programs happening, but we found out a lot of programs are happening in isolation. How to make this program working together as a holistic approach? If you can throw some light on this, sir.
Thank you, sir. I think technology has advanced, and I think 4G, and now we are going towards 5G. But internet connectivity down below, I think, would be one of the biggest prohibitive factors. Though we live in Delhi NCR, but as you go down from the state capitals to periphery, tier 2 and tier 3 cities and villages, the internet connectivity has not kept pace. That is one. Whether it's from the data uploading from the patients, whether even the government's HMIS and others, regular data uploading is always delayed because internet connectivity has not kept pace. This has changed a bit in the last few years, but that would be the primary barrier on that. Secondly, acceptability. Many of us, even the older generation, I will say, there was really a lot of hindrances and the government systems earlier. This is changing pace slowly. I remember if I leave the health sector, we go for a voter ID, Aadhaar, passport, driving license. There was a time we used to fill up a 4-page, 5-page form, be in a line, take a queue. Now everything can be done online, payments from UPI, Paytm. I think demonetization as well as the last, during the pandemic, we are gradually accepting all the, whether it's a payments or things. And secondly, the government's efforts in this direction. The technology, whether it's the Airtel, Vodafone, and all the companies in the health sector also, as the government is making it law binding, reaching out, even the file movements, as you mentioned, you have mentioned, but there was no update on the government is still moving in the files. But I know 6-7 years back when I visited Maharashtra, e-file system was running since 2014, 15, 16. The files from Pune to Maharashtra used to go on travel online, and that speeded up the process when earlier it was there. And this is going on from central government to various state governments as well. Of course, health being a state subject, so Tamil Nadu, Kerala, Maharashtra are much more advanced, and UP, Bihar, it will take much more time. But this technology uses is coming up, some by mandate, some by force, some by habit. So things are moving on. So these would be some of the key barriers I feel.
And you picked up, Dr. Pushkar, probably most common practical barrier that we have seen, that's the availability of internet. There are a lot of times we do talk to organizations, said that, okay, our services are only available through internet. There is no other mechanisms that you can reach out and avail services. But the challenges what we face is there are times when there is no internet available. And this is not on the rural area. There are times internet services are not available even in metros. I live in Delhi NCR. I experience that there are times when we are even talking over phone and traveling from one place to other. There are times when we have to reconnect 2-3 times to complete the conversation. So definitely having a bandwidth which is stable, reliable, and trustworthy is very, very important. Other than that, this will not work. And this happened in my experience of working as a startup. We work with several organizations, and then when we go and talk about it, finally, they will come back and say, even sometimes it happens not only other customers, our own staffs, that there are times they said that, sir, it's always better to carry a paper document with us so that we can complete the work. So I'll share a quick experience. So what we do as an organization, we provide home diagnostic services beyond pathology. So typically, most of the organization, they provide home diagnostic, which is equivalent to phlebotomist or blood sample collection. So we found there's an opportunity, particularly post-COVID, during COVID, that the other diagnostic services are also required at home. So what we have started doing is, we are doing X-rays at home, ECGs at home, pulmonary function test, and the list goes on. Now there are non-pathology services which typically was not available at home. We have made them available at home. We are offering our services currently in Delhi NCR and going pan-India. Now there are times it happens, even in Gurgaon, we reach people's home, and when we are conducting the X-ray, we are not able to send the images. We follow a philosophy called 1 minute, 1 hour. Means in a minute, we provide the image. After the test is being done, within an hour, we provide the report. Now, all these things, all commitment works when we have internet bandwidth and connectivity available there. So if we are reaching people's home, and that point of time, the technician's phone is not connected on internet, or his internet connection is not stable, to send the images, then our commitment of sending images within a minute goes for a toss. We can see the images coming on the laptop. We use a DR, a digital recorder. The images immediately comes. But we need to send the images to the cloud. Once it is on the cloud, then everything works. Then we can share with the patient, share with the doctor, we share with the radiologist for reporting, everything works. And unfortunately, this is a practical reality in Gurgaon. There are times when they would come back office and then they will send the image. Now, with 5G, I hope this will be a history. This would not be a problem any further. In our discussions with the colleagues who are working on the telecom sector, we always keep telling them, the guys, at least ensure the internet works. It works faster, or we all are trying to make the bandwidth higher. This is all fine, but ensure that it works. If it is not working, then none of these digital initiatives will be working. So you picked up a very, 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 very important point that we are facing every day in our life, when we are reaching out to patients home and trying to provide services. The other important factor where Dr. Pushkar, you have taken up, I think this is about the users and the patients and their families. They will push this. Now they have understood the benefit of getting the digital records, right? So, initially when we started this around a year back, maybe in January we have started. So we said that, okay, we will give everything digital. So we don't print anything. We don't give any printout to patients. We give digital X-ray images, ECG tracing, everything digital, including the report. But in the back of our mind, we thought that there will be 50-60% patients, though we are pushing, they will request that you please give us a printout, otherwise we will not avail your services. But to our surprise, I think it is less than 2 to 3% that we are printing. We are giving everything digital. It is available on our portal. People are coming to our portal, accessing it, or sometime we do send it on WhatsApp, which may not be the right thing to do considering a lot of other factors, but we do it with the patient's phone number only. But a digital record sharing and record keeping becomes a reality, and this is happening because the patients have accepted. Otherwise, this becomes a problem. Sachin, I think you have a question. Go ahead.
Sir, I just wanted to remind you that there are a lot of questions coming in the Q&A tab, so if you can pick them up.
Fantastic. So let's see. Give me a second. I'll go over there. So there's a question, I think Sunita Chauhan has put up about this digitization scope limited to the just patient records. And I don't think so. Personally, if you ask, absolutely not. This is beyond, and any other record will get digitized. And particularly coming back to our topic for the day, how this digitization is going to work because of the National Digital Health Mission will ensure the health records are portable. Doesn't matter which hospital, which clinic, which doctor that we are visiting, with patient consents, this data would be made available to a clinician who is taking care of the patient. So this would be definitely beyond that. Data security aspect is another question. Dr. Ayushi Chaturvedi, I think reliable in terms of data security, especially in India. The answer is yes. But if you ask, there a lot of work needs to be done over there. Nothing happens automatically. We have to get things done. So data security is an important topic. We need to ensure that that nobody is able to take our data out. But I would like to remind you that we keep our ATM card and PIN secure, right? We don't leave this together. Normally, a lot of times people have been asked that even if you are not able to remember your PIN, don't keep your card and PIN together. So that even in case you lost your card, then the PIN is just not available to the person. He has to do some hard work to find the PIN, right? It's difficult. He may still can figure it out, but it will not be easy because after 3-4 attempts, probably your bank will disable the card. Now, unfortunately, and this is something like various experiences that we have. Whenever we are looking at creating passwords, particularly for the healthcare professionals and for the patients, you will find out these passwords are very easy to guess. Very easy means it's very easy to guess because we don't think this data is as important as our financial data. So as a professional or as a person, we also have our part of the responsibility here. So we cannot feel that I will keep my house open and nobody will come and take it. Yes, in ideal world, this is not the way to work. But if you look at as an organization, if I ask someone that what is the kind of a budget they have from data security, typically budget is zero. It's unfortunate, but this is the reality of life. So we have to put some budget to create a lock. First a door and then there's a lock on the door with a unlocking mechanism, which is very difficult. This is a very important thing, and this is all available. It is not that it is not available. So does that mean that the financial data are not getting hacked? Answer is yes. but it is difficult to have. It's not that easy because we all feel our finances are very important, so we will keep it much more secure compared to our health record data. We keep sharing this health record data like anything. Digital people sometimes take it up and then do talk about that sharing of the data, etc. But I think that is going to happen with everyone everywhere. We have to be extra careful ourselves, and that will ensure that our data, either as an organization or an individual, is not going to be misused. But we need to play our role. I'm sorry, but this is the way I think is practically going to happen. We cannot always say the other guy is responsible for my safety. I need to play my own role to create my ID and password, or password in such a manner that it's not that easy to guess. But unfortunately, that's not the case in healthcare ecosystem. We need to change this practice. I think there are a couple of questions, Dr. Pushkar. If you can just take up one or two of them.
Yes, sir, definitely. One is, of course, in the studies by PHFI on the health workforce. So, yes, PHFI, we have good research units, and our IIPH and other units have conducted a few studies. Very recently, on the skilling part, not only a skilling part, with WHO India, IIPH had conducted a study, and a report has been just released. It is available on the WHO website as well as PHFI website on skilling, and specifically, no specific, but there is a lot of scope and requirements, because once the digital health mission is going on, and this is very much a need as well. And then one question I had come earlier for nursing courses for the diabetes and others. PHFI does conduct a lot of training programs, but in the diabetes and other clinical areas, the courses have been for medical officers. We have conducted, we do conduct for nursing and other staff on healthcare quality, patient safety and communication, barefoot counseling. Details are all available in public health management on the PHFI website, phfi.org, or my email, I'll mention it in the chat box. I can write to, anybody can write to me on that training aspect as well.
So, Jin, I think Mr. Abhinav has joined. So,
Yeah.
if you can just introduce him for a moment, and then probably he can share his thoughts.
Sure, sir. So maybe Abhinav, you can switch on your camera. So he's also been a very active club member, and he's a serial entrepreneur. So maybe Abhinav, you're welcome to introduce yourself.
Thanks, Sachin. Thanks for introducing me to this seminar on digital health mission, and it's a privilege to be here and discuss about the critical points. I would like to just briefly mention that like digital health is becoming a national necessity at this point of time. It's a requirement of the need, right from the data analytics to predictive health to remote monitoring. These are the key aspects which are very important in the digital health aspect, in my opinion. And what how it has shaped up is because of the corona times. It has made us all realize that that access to health in all corners of the country is a necessity. Now, but what is important in this is that the healthcare that should be available should be timely, it should be location agnostic, it should be cost effective, and the quality should be of a higher standard. And that's where digital health records play a pivotal role. They provide all the promises of all of these effective aspects, but it has particular challenges. First of all is that the data has to be extremely accurate. It has to be real time available to all the clinicians, and not all signs can be captured. So we deal particularly in we have been developing a telemedicine related application, which can monitor all the vital signs, right from ECG to BP to sugar to all your portable lab diagnostics, and which keeps it in a digital health record form. So what we've realized over this period in this aspect is that the infrastructure that would be required both from the clinical side as well as from the patient side is going to be enormous in terms of data security, and at the same time access, and at the same time the kind of records and history that needs to be maintained to provide the analytics that are which are relevant for the clinicians. So my concluding remark, or very brief concluding remarks to this would be that telemedicine has definitely a big future, and digital health will play a very pivotal role. But right now, from the Indian perspective, we have a few steps to go in infrastructure and from national integration perspective to make that a very effective tool for the clinicians as well as the patients. So with that, I'll just quickly close my brief opinion on this topic.
Abhinav, if I may ask you one question.
Sure.
You are a practicing digital health person and your organization is playing a very important role over here. So tell us your experience of have you worked with National Digital Health Mission guys? Have you looked at their APIs? Have you tried to use them? What kind of challenges that you were facing when you were trying to interact through the National Digital Health Mission portal and the other providers?
So actually, right now we haven't really integrated the National Health portal and the APIs from there. Right now, we have just integrated the devices. We've actually been able to get all the devices integrated with our platform and made that available over a real-time platform to all the clinicians as well as patients. We've at this point of time just been able to connect the clinicians and the patients. We haven't. We have made the infrastructure, or I would say, all the database or that aspect for the patient data. But we have to still integrate it with the digital health mission of the Indian context at this point of time. So we still are taking effort in that direction. So I wouldn't be the best just to say what are the pros and cons unless and until I fully understood what is available and what can be utilized and whether we have got access to utilizing them at this point of time. So at this point in time, it will be too early for me to say, but definitely in a period of 2 to 3 months, we would be in a position to understand that system completely and integrate it also from our perspective.
Okay. Sachin, you have a question?
Sir, I just wanted to make an observation, if that's okay with you.
Yep.
So, when I was, for the last few years, looking at the digitization topic in India, I think we were all very excited about building tools. And you have rightly said that, we have talked enough and it's time to execute. But now that I have been for 1 year now here in Oslo, Norway, I see that AI in healthcare, for example, is a big topic here. And they are mostly focused on two parts, when it comes to building AI solutions, is that building AI, that hype cycle is already over. So they are more focused on deploying AI. And it actually boils down to the capability at the clinical side, to understand the clinical evaluation of an AI tool and their ability to maintain the whole life cycle. For example, is the AI tool reliable? Is it trustworthy? How is it impacting the decision? So I see that the people in the healthcare fraternity here, they're very worried about these kind of topics. And I don't know, do you see this kind of maturity in Indian healthcare system already? That are the large hospital systems having some kind of clinical evaluation teams that they could generate evidence, or they could calibrate these kind of digital tools from time to time? How do we know, like many people have asked, if somebody is tampering with data, can they detect? Is there a good enough understanding of using digital tools? I mean, one aspect is building and deploying, but eventually somebody has to use them and be also critically evaluating them.
And absolutely a brilliant point, and this is something that we are seeing more of it now, because now we have one couple of steps in our journey, both in digital and during digital using AI and other technologies. So for that matter, it's very important now we start embracing this digital health in our life, start using it. And Sachin, as you rightly pointed out, is to find out the challenges that we are facing during the uses. I always talk about one point in most of our discussions is about the data. The data is only effective when it is captured appropriately. While we are gathering more data in this era of digitization, collecting the data in the appropriate manner becomes very, very important. Otherwise, it would not be of use to us. So we have to be probably a little more careful when we are capturing more data, and then capture in the most appropriate manner for users. There are times when we have seen that we don't probably consider the data collection or entering the data as seriously as it should have been. And there are times our research, etc., has generally gone for a toss because we can't rely on the data. Or even I have seen organizations where they even can't trust their own data. So that's a challenge. This is a request to the hospital and health management professionals everywhere, and it has to come from the top that please do consider the initial data collection as a very important activity. It is being done by the most junior person in the organization. A lot of times, there are times that clinicians are also entering their own data, but if the data are not captured appropriately, then in future, whatever the digitization and the impact and the effect of digitization that we are emphasizing, that is not going to happen. So, a sincere request to the fraternity, to all of us. It's very important for us to capture it in the most appropriate manner. And then, when the interoperability is coming up, the UPI-like structure is coming up in healthcare through the National Health ID and National Health Mission. If the data are captured appropriately, we are going to get the benefit immensely. This is very important, very exciting time for all of us coming ahead. We would expect that anytime all of us would have access to our previous health record on a click of a button, and definitely I repeat it, this has to be completely privacy enabled. Patient is the owner of the data, all of others are custodian of the data. The owners should have the decision making ability, that where to share, when to share, and whom to share. There should not be any compromise on this factor. I see, Dr. Amit, you are back. I hope the patient is doing well now.
Yeah, patients. Yeah, angiography is
fantastic. Oh, okay. So I thought, sir, I will ask you another questions, and as you were dealing with the patient. So, other than the AR, VR, is there any other digital initiative that is going on in your mind that you want to implement in your day-to-day practice? What, as a physician, as a clinician, you are looking at from the National Digital Health Mission? What actually, as a clinician or as a fraternity representing the clinician, what do you think is going to change the way you practice today? If you have to pick up for probably two things, then what are those top two in your list?
Yeah, one is see, the prime problem statement for us at this moment in after COVID is constant training and teaching for critical care, especially in the nursing part, and availability of doctors. And with Ayush and Ayurvedic doctors, BHMS doctors getting into this ecosystem, so I feel digital approach to merge this problem statement of availability, lack of people will definitely can be addressed, and constant teaching program with this digital approach to nursing. Like for example, we are working on a project where how to during a Anganwadi, for an Anganwadi worker, how a delivery can be made with all proper clinical guidelines. I mean how a teaching for a delivery for an Anganwadi worker can happen. I think digital approach via videos, digital approach via VR, AR can merge this on a virtual platform, like a constant training of these Anganwadi workers, so that we don't lose out. So keeping that, reducing the MMR, the all these parameters. So definitely, I mean, this is one angle where I feel primary healthcare, improvement in the primary healthcare via digital route is going to be really effective. And early diagnostic tools with all those IoT devices around the corner, with these IoT devices, digital integration, early diagnosis of whatever clinical condition the patient comes in on a primary healthcare should be also looked into, because these two areas that I feel constant educating, and probably availability of medtech early diagnostic devices in these centers and connecting them to hospitals and doctors would definitely bridge the gap and bring in more value to our ecosystem. Because at the end of the day, we need to bring in digital ecosystem is only helping to increase the value which we offer to the patients. I mean, it is only how we increase, and there are tools where we have to measure how we measure this value which is getting created of a digital route is something for us to kind of also look into, so that people and the government and institutes can really say, yes, there is a value which has been measured, and this is the outcome which is really we are getting it. So I feel these two areas, I feel for me, I feel as a clinician, this will help us to improve the primary healthcare, which is really need of the hour post-COVID.
Fantastic. You picked up a very important topic, because there are a lot of time we get into this tertiary healthcare part of the story, but the real healthcare lies in the primary healthcare. If we are not able to strengthen that using a digital mechanisms and getting the benefit of the National Digital Health Mission, then we'll miss probably most of the healthcare being practiced. So that's a very, very important topic that you picked up, and I am sure in other discussion, if I get an opportunity, we do talk about with the National Digital Health Mission guys that how they are going to incorporate this more in their programs. There are times when we find out that the discussions are between the hospitals and the other providers. We have seen less interactions probably with the workers and how they are going to be completely integrated in this. But without them, the healthcare is not going to work. So this is a fabulous point, Dr. Amit, and thanks for taking this up. So I think we are.
And I'll give you a use case example, because one or two startups from Bangalore and also from San Francisco have been working on same model where educating nursing staff in the rural part of America. And Mayo Clinic has taken this as I'm part of their advisors as well as friends. So Mayo is really looking into this as a as a program within their system of educating nursing staff, and probably Apollo also would join in sooner or later in India. So I feel digital getting into the primary healthcare is the need of the hour post COVID. And we all focus, because all the digital approaches are towards the largest city, that is a metro. A lot of apps around, a lot of devices around, but what happens to a secondary or a tertiary tier cities, and especially the rural part. So I feel India is the best country where with huge population around, and our biggest strength is our ecosystem of primary healthcare, CHCs, PHCs, which already the ecosystem has been laid. It is just that we need to enhance it, put in more of governance to it, and we see the huge phenomenal results within in the next few years. So I think we are moving ahead. It is just that with the huge population as standing in front, it will be a tough challenge, but no sooner or later it will be easily connected, because 4G, 5G, in the rural village, people are using, all these Androids and these smartphones, and just integrating digital approach on their own health would not be a larger challenge.
Fantastic. I think Dr. Amit, you have shared a fabulous understanding on this topic. Sachin, I understand Dr. Meena is unable to join because of some government meeting that he has to join right now. So probably we'll have him in our next meeting sometime. I'll request you if you can have him join us in any of the other meeting, and then we can get enriched by the thought that you plan to share. And if is there any other questions that we have missed to respond? I think there is no further question. So in that case, I would like to thank all the panelists and all the participants here in this club meeting. And with all of your permission, then we may end the club meeting. And then you can have a vote of thanks.